Revenue cycle terminology, letters N through P. Flashcards, terminology followed by definition. Glossary of terms from NAHAM and AHAM. National Correct Coding Initiative, NCCI. A Medicare initiative to promote correct coding methodologies and strive to eliminate improper coding. It identifies mutually exclusive CPT and HCPC codes, or those that should not be billed together. Network. A group of two or more computer systems linked together. Variations include wide area network, which is more extensive than a local area network, which is not publicly accessible to a greater internet. A hotspot is a wireless LAN that provides internet access from a given location. Notice of observation treatment and implication of care eligibility. An act requiring hospitals to use the moon to inform patients who are hospitalized for more than 24 hours if they are in observation status. NPI, National Provider Identification. A unique 10-digit identifier issued to health providers in the United States by CMS. NUBC, National Uniform Billing Committee. The entity that governs the UB04 and 837I forms. Number of patients seen per day. The total number of patient encounters for all physicians' specialties in the time period divided by the number of days in the time period. Observation. The level of care given to a patient who occupies a bed but is an outpatient intended for monitoring of an acute condition, which may resolve or worsen, cannot be scheduled in advance, and is not intended for routine use, such as surgical. Office. Care provided in a practitioner's place of business. A practitioner may be a medical doctor, podiatrist, chiropractor, dentist, advanced practice nurse, registered dietitian, physical therapist, psychologist, or one of many other professions. OIG, Office of Inspector General. A government agency with the mission to protect the integrity of HHS programs and the health and welfare of the beneficiaries of those programs. It has a major role in investigating fraud and abuse. Out-of-pocket maximum as defined by AHAM. The maximum that a patient must pay on his or her own because the costs are not covered by any payer. Out-of-pocket maximum as defined by NAHAM. The total payments towards eligible expenses that a covered person funds for him or herself and or dependents. These expenses may include deductibles, copays, and coinsurance as defined by the contract. Once this limit is reached, benefits will increase to 100% for the health services received during the rest of that calendar or policy year. Deductibles may or may not be included in the out-of-pocket limits. Observation care. Those services furnished on a hospital's premises, including use of a bed and periodic monitoring by a hospital's nursing or other staff. Services should be reasonable and necessary to evaluate the need for a possible admission to the hospital as an inpatient. Observation services usually do not exceed 24 to 48 hours. Hospitals are not expected to substitute outpatient observation services for medically appropriate inpatient admission. Services not reasonable and necessary for the diagnosis or treatment of the patient, but provided for convenience of the patient or physician, are considered an inappropriate use for this level of care. Outpatient. A level of patient care provided in one of many types of outpatient clinics: urgent care, IV therapy, pain management, substance abuse rehabilitation, wound care, etc. Outpatient care. Treatment received at a hospital, clinic, or dispensary, but the patient is not hospitalized. Examples of outpatient services include ancillary services, emergency services, ambulatory services, same-day surgery, specialty clinics, reoccurring services, long-term care, respite care, and hospice and palliative care. Palliative care. The medical specialty focused on the relief of pain, symptoms, and stress of serious illness. The goal is to improve quality of life. Palliative care is appropriate at any point in an illness and can be provided at the same time as curative treatment. Part A. A hospital insurance component of Medicare that covers medically necessary inpatient hospitalization, care in a SNF skilled nursing facility, following a 3-day hospital stay, home health care, and blood. Patient Contact Center. A central point in the organization from which all customer contacts are managed, including scheduling, pre-registration, pre-verification, prior authorization, functions, etc. Patient experience. The outcome of interactions between an organization and a customer as perceived through the customer's conscious and subconscious mind. It is especially important in determining HCAHPS reimbursement. Patient placement. Includes a request for a bed, inpatient, outpatient observation. It involves the collection and documentation for the information necessary to determine that the requirements for the requested level of service are met. Patient portal. A secure online website that gives patients convenient 24-hour access to personal health information from anywhere with an internet connection. Some portals allow for the viewing of recent hospital visits or the ability for the patient to self-schedule certain tests to be performed at a hospital. Patient satisfaction. In evaluations of healthcare quality, patient satisfaction is a performance indicator measured in a self-report study in a specific type of customer satisfaction metric. Personally identifiable information, PII. Any type of information that can be used to identify a person, such as a name, social security number, and medical record numbers. Point of service, POS. Point of service, the only cost-effective collection point for copayments. Power of attorney. Type of living will. This document authorizes a specific person to make decisions on their behalf when they have become incapacitated. PPO. Preferred Provider Organization, one of 5 types of Medicare Advantage plans. It has a network of providers who have agreed to contractually specified reimbursement for covered benefits. PPS, Prospective Payment System. Pre-certification, pre-authorization. Certain insurance companies require pre-certification or pre-authorization from the healthcare provider prior to services being performed. The process of obtaining advance insurance approval for payment to be secured later. POA, present on admission. Present on admission is defined as the conditions present at the time the order for inpatient admission occurs. POA indicators are intended to differentiate conditions present at the time of admission from those conditions that develop during the inpatient admission. Presumptive eligibility. Hospitals and qualified physicians have the option of screening patients to see if they qualify for Medicaid. Based on the patient's self-attest answers to specific questions, they may be granted this temporary coverage, but must complete the application process in order to keep the coverage. Preventive services. Services intended to preserve good health, detect disease at an early stage. Most insurance plans cover these services at 100%, not subject to deductible or coinsurance. Price transparency. The price of healthcare services that, together with other information, helps define the value of those services and enables patients and other healthcare purchasers to identify, compare, and choose providers that offer the desired level of value. Propensity to pay. A means to evaluate payment risk, determine the most appropriate collection policy, and initiate financial counseling discussions. Based on a scoring algorithm, programs can predict likelihood of payment. Those with a history of bad debt can be adjusted or forwarded to collections at the earliest point possible. Protected Health Information, PHI. Any protected health information, PHI, as identified under HIPAA, that is produced, saved, received, or transferred. Provider Self-Disclosure Protocol. A protocol published by the OIG to promote voluntary disclosure of potential violations, offering an offending provider the opportunity to minimize the potential cost and disruption of a full-scale investigation and negotiate a fair monetary settlement. PSDA, Patient Self-Determination Act. A legislation that ensures that patients understand their right to participate in decisions about their own health care deals with advanced directives. Want more content like this? Go ahead and subscribe if you haven't done so already. Share your thanks and appreciation and smash that like button and share the video with somebody else that I'm sure just like you wants to pass their CHAA.